came down here to Panama to help out and kind of get back the feeling for why I entered medicine to begin with. I've gone camping, but this is to a whole different level. You are completely cut off from civilization.
For me, it was amazing to see how people live that far away. Amazing that they're that far away from health care, emergency care for that matter. It's a long walk.
It looks like a piece of cake, but once you get up there, it's pretty scary. Current's pretty strong, and you want to stay dry. It's not realistic. You're gonna get wet.
Bushmasters. That was pretty unique. If you were to step on that and have it bite you, imagine you'd be in big trouble.
Don't get bitten.
So we started to set up the clinic in one of the school buildings. And by the time we are doing this, there are like 20, 30, 40 people all the time watching us. One guy that came up to me and he had lower back pain, right? As I examined his back, he had these small points along his spinal cord. They take a needle and heat it up and they push it into the skin to lower the pain in the back. He said he had some help of it, but he needed some stronger medications as well.
I was really touched by the 12-year-old kid we had. And he pointed to his heart and says, like, it hurts. Yeah. And then you looked at it and we did the ultrasound and he saw there was something like structural defect and he has an enlarged right atrium. And he's like, he can't play with his friends. And you already see how that impact is on him.
I'm making up a solution of scabies treatment. There's a lot of scabies here. Some lice and a lot of scabies. At Sabana, we really worked on dental health because we had all these toothbrushes that were donated to us by Global Grins, and we got to give them out and kind of do toothbrush kind of etiquette, how often and how you brush your teeth, which is great. Then we also did ORS, which is oral rehydrated solution. Long-term priority is water. They all have parasites, and when you look at where they're getting the water,
we were sort of finishing up for the night. Everyone had started putting up their hammock. I turned around and there was another child there, and immediately I went, this child's sick, he's floppy, he just had all the classic signs of a severely dehydrated baby. We made up some ORS and we started trying to give this baby some ORS, oral rehydration solution, through the syringes, and gave it some antibiotics. There's about 7 children under 10 who died in the past year, mainly of things like diarrhea and vomiting. I think there's probably a good reason that a lot of the kids out there are still called Chi-Chi up until the age of 2. We were worried that the mother and the father and the baby might have actually gone back home during the night, and we went to check on them and the baby did look better. So probably that evening actually, that's when I sort of realised I was exactly where I wanted to be, just falling asleep in my hammock, even though there was a spider, a massive spider right next to the hammock.
We got the call that a boy had cut off his toe and it was hanging, and we began a walk which was supposed to be 30 minutes. It turned out to be about an hour, and the whole way myself and Martin, the general surgeon, were just thinking this is the longest emergency call we've ever done, and quite a strenuous walk. So by the time we got there we were naturally quite exhausted. Didn't quite know what to expect. Kind of shocked at how calm the patient was. I mean, he's a 10-year-old boy and he's just lying on his own in a room. The angle the toe was at, it was quite clear that he'd gone straight through the bone. We injected some lidocaine, gave him like a digital nerve block. I've assisted in toe amputations, like in a sterile theatre in England. It's very different being confronted with that same situation in a rural, developing country.
Completed the amputation, stitched up his other toe, and he looks great. We went and saw him. This was 2 days ago now. We went yesterday and saw him. He's doing great. Gave him antibiotics, and hopefully the next time we come up we'll get to see a scar.
Martin was great. He was very calm and took it kind of as a teaching opportunity as well, which kept sort of the atmosphere in the whole room calm, which made the whole operation go quite smoothly.
That was my first surgery outside of a hospital setting, and it was hard to debride back bone without any appropriate equipment, but I think we had a very good closure for where we are, and hopefully he'll do fine.
You realise how many people we've managed to connect with over the time since we've been there, Initially at first, obviously, because they're a rural community, they're quite cautious about letting strangers in, and then by the time we leave, you feel much more welcomed and like we did a good job.
I think there's a lot of cultural exchange that happens every time you go out there, and every time you go there, you get a little bit more from different people.
The education and the actual trust building is probably the most important thing that floating doctors does. Here you learn like what it actually means to say I am your doctor. Like, you know, the promise you say when just by saying that, like, you know, hi, I'm your doctor. That means something here, I feel, which people forget.